bearded Biomed.
Welcome back, all my bearded guys and gals that listen to the show. Appreciate you being here with us today. So I have someone that was kind enough to let me come onto their podcast. And of course, you know, I'm sure he's more than willing to talk about it so we can get you over there listening to what they're putting out. But today I am joined by Jinesh Patel. I appreciate you being here, sir. I had a lot of fun during our conversation on your podcast, and I would love for you to just, you know, let the listeners, the watchers get an idea of what UptimeHealth does, the podcast, and just kind of like the journey where you're at today.
I appreciate it, Chase. Thanks for having me. Just some context about UptimeHealth. Our company is trying to automate or turnkey how outpatient ambulatory facilities manage their medical equipment. We know they do a poor job of it today, so we want to provide them with the software to really help them understand what to do with their devices, who to call when it breaks down, and really just create a simpler process for them. As part of the company and some of the promotion we do, we have a podcast called No Filter Healthcare. And we just bring on interesting people in the industry to talk about their perspectives, what they see. Loved having you on too, you know, as a biomed engineer myself, getting to talk to somebody else, you know, that's lived and breathed some of the things that I did back before I built the company. That was always fun. So I appreciate you coming on.
It was a good convo.
Yeah.
We kind of got into a lot in a short amount of time. So to start off, you came out guns blazing. So I would love to hear how medical devices aren't being taken, you know, managed properly, as you alluded to. Would you mind going in a little bit more depth with that?
Yeah. And I'm not trying to throw anyone under the bus, because I really believe people would do if they knew what to do for these devices in these settings. But one of the things I learned early, going to urgent cares and even surgical centers and dental practices, optometry practices, all these places with medical equipment that provides patient care, a lot of them, especially in these smaller arenas, they're just run and operated by doctors, nurses, assistants, staff members. You don't really see a biomed in that department structure. One, it might not make sense for them to even have one, right? They might only have 100 pieces. So why have a full-time person? So they rely on these outpatient, or not, they rely on these like outsourced vendors to do this work. And, you know, even then they don't really understand what's required of the machines when technicians out on site ask them, hey, have you done this to this machine yet? Or what kind of maintenance plan is actually on this device? And they don't have great answers. So I want them to be able to feel confident in how they manage the equipment. But every client that's come to us today hasn't really had much starting out. And I actually applaud them for trying to get better at it. The whole reason they're using us is because they understand they need to be better. So I applaud them for moving in the direction, but it's definitely kind of scary to see what's out there.
Yeah. You know, it's funny with our company, we got reached out to by a hospital just out in the middle of nowhere. This is a very rural-esque LTAC. And from what we gather is they don't have an actual inventory of what equipment they have. The inventory they sent us does not match what they say they do or don't do. And that tells me two things. One is, what is the Biomed doing? Because they have a full-time biomed, and we'll get into that in a second. The second thing is if you don't know what you have, how are you servicing it? How are you doing the preventive maintenance? How are you ensuring calibrations, batteries, reporting? All of that are where they need to be. Yeah. And part of this goes into what I just alluded to is the biomed they have. I don't think he's an actual biomed. I think he's probably a mechanic or maybe an electrician or something like that they're using to, you know, Band-Aid things together when they need it to. Yeah. The second thing is when you're getting into medical device compliance, for instance, Texas, I would say we're probably one of the more heavier regulated states when it comes to like Joint Commission, DMV, state surveys, etc. This particular hospital is in Oklahoma, and as far as I'm aware, it's just state survey. You don't have to deal with all the compliance stuff because most hospitals out there, they don't go after the accreditation, which that's a whole nother thing entirely. For the listener or watcher may or may not know, the accreditation comes with funding through Medicaid, Medicare services that really give another leg up and an edge to a hospital to facilitate better rounds and better levels of care for a patient. And that hasn't really been the case from what I've came across in Oklahoma, because I was actually born there. I have family there. I'm very familiar with the medical infrastructure of Oklahoma. So I'm not just speaking out of my ass, but it's a little bit of the Wild West when it comes to medical device regulation. And tying this back to what you were talking about is, we can put all of this on top of the facility itself, not having the knowledge of how to manage medical devices. But this also goes to, for instance, the ISO companies like the one I'm a part of. This is where you step in and, share your knowledge and obviously do the due diligence to do good by these facilities. A lot of these people, they don't even know what a biomed is or what our responsibilities, what are, at the end of the day, the biomed is used for taking care of medical equipment, helping with accreditation, and, fixing stuff. Most of the time, people just look at this, okay, who do we call to fix this?
Yeah.
But the accreditation and the reporting is where people get into trouble a lot. And I'm assuming that's a big thing that you've run into a lot too, is they don't know, what are the inspection levels, like what equipment has to be checked, during the sync intervals. Is it an annual inspection? Is it semi? What, how in depth is it? What's required? Because, the servicing on, like, let's say an anesthesia unit is going to far surpass like a blood pressure monitor.
Yeah.
But I'm just curious, what kind of, do you have any particular things that you can, recollect of what you've came across out there in the wilderness?
No, I'll echo the same. You go into most of our clients, they honestly don't have even an accurate inventory roster. And like you mentioned, how do you manage what you don't know you even own? Because you can't have an accurate program at that level. But the biggest thing is some of them, they believe they're doing the right thing. And when you try and tell them, otherwise, it's a little bit of a friction moment, because one, you just told them you haven't been doing it right for years before me. And it's like this moment of realization that, oh my goodness, like I might have actually affected patient care poorly. And they don't want to admit that. They want to kind of stand their ground saying, we don't have to do annual this. We don't have to do semi.
Yeah. Who are you to tell me I'm doing it wrong?
Right. I know this practice. I know healthcare. Who are you? Kind of situation. That's exactly right. So I run into everything you just mentioned. And at the end of the day, the best thing we can tell them is we are here to help you. We're not here to punish you. We're here to help you level up and get you to that next sense of, I'm here, like you mentioned, people have accreditation. People have other regulatory bodies ensuring their quality of care and their standard of care is high. And those are the people that really take pride in it if they're trying to go for it. But at the same time, those who don't, those are the people that we kind of run up against and try and let them know you're just not doing things correctly. We would love for you to reduce the breakdown so you can increase the patient volumes and increase service, everything. Everybody wins at that level.
But, the number one hurdle that we come across time and time again are two things. One, the stubbornness of the person that has been managing this, whether, through ignorance or just, blind, not paying attention to it. And they just, like you said, they can't accept that you have a different perspective or maybe a completely different take on how they're managing their medical devices. And sometimes people will take offense to that, or maybe it scares them, or, maybe a combination of both. But at the end of the day, that leads down to cost.
Yep.
And, for that hospital that I brought up a minute ago, the cost of what they're using to do what they're doing now is pennies on the dollar compared to what it actually takes to maintain that level of service, reporting, full-time technician, the repairs, all of it.
Yeah.
And I believe when you start throwing quotes out there for what it's actually going to take to get them in, respectable regulatory compliance, that's when stuff gets tricky. And, you have a company that has been doing this, deals with the regulators, knows exactly what the expectations are. And as opposed to wanting to spend the money to get there, they'll go run after, a mom and pop ISO service. And we keep running into this time and time again, but, a lot of hospitals, we had closures. A lot of the critical access hospitals, LTACS, because they're spread all throughout Texas, speaking specifically, COVID really hurt people. Medical facilities in general in these rural areas that I'm just talking about specifically. And those closures were a direct hindrance of they did not have the ability to bring in patients. They did not have the funding from because they're not accredited, or maybe they lost their accreditation. There's a whole plethora of stuff. It's kind of like it's been an interesting couple of years, especially when you just take all those factors and just kind of compile them and look back and like, wow, this has kind of changed the landscape a little bit.
Yeah, I think when you hit it on the head a little bit with the things we run into when we talk to new people. It's this cost. But we never paid this much before. We never even had a process. So why are we paying for it now? And getting over that hurdle. So the biggest way that we combat that is we go to their CFOs and we go to their operators. We ask them the simple questions that to me and you and most other people probably make sense, but maybe they never did this, drawing the line directly to revenue. So, we say you have an equipment, it fails because maybe it wasn't maintained or managed properly. You put a lot of effort and energy behind it. Well, because that product has now failed in your patient care environment, you are re-triaging a patient somewhere else or moving them. That is cost, time, and energy. You are now maybe taking down a whole room for a period of time, which would be billing services on top of during that moment in time as well. But it is now unable to collect revenue for you. You now have nurses on staff who might have been managing that room or multiple rooms, and you might not need that overhead, but you're paying for it. So there's a lot of these things and these costs that they're not creating in their head because they just see it as a direct cost. They're not seeing the missed revenue, the operational disruption. When we think about physician and provider burnout, we're adding wrenches, we're throwing obstacles and dodgeballs at them now while they're still doing patient care.
Yeah.
And when they start thinking about it in that macro level, the ROI is simple. It is there. It is undeniably there. But they just see the pennies on the dollar, like you mentioned, and saying, well, now I'm paying 50 cents on the dollar and I was paying pennies on the dollar. How do I make this make sense? So that's how we've talked to them. And to be honest, and again, to their credit, once you help them connect the dots, it's no longer, what are you talking about? How's that much? It's more like, that's interesting. I have to think about that. It's at least a moment of consideration versus just absolute no. But you're absolutely right. That is one of the biggest things.
I like that you come at them from a ROI perspective because, one of the things we talk about within the biomed industry is a lot is, we went from simply fixing and maintaining stuff to having to get into talk about distributing budgets and consolidating expenses and, handling lifecycle management devices to where it makes sense to, move from a contractual obligation to time and materials because of how much it's going to save the facility. And then that's where the biomed really comes into play when it comes to one, justifying our services, but also, bringing value to all the medical facilities, because at the end of the day, they have to manage within the constraints that we have. And unfortunately, with the landscape of medical in general, those constraints have kind of been a little bit constricted. The landscape of medical care in general is this kind of like it's shifted from when I think about like, insurance plans and everything from like when I was a kid to what it is now. And it's kind of like, everybody's just trying to see what the others does. Right now, we're in this space where a lot of facilities I see are getting bought up by like corporations, for instance, and then they get repackaged, retooled, put back out. They get their ROI, and then it gets recycled again from the next buyer and so forth. It's kind of been that way for the past at least 5 years from what we see, especially within our area, which makes it very hard when it comes to managing medical devices. Because, for instance, like when you think of like ERs, for instance, this one has been prevalent in Texas.
Yeah.
You'll have one system, they'll sell, another one picks it up. Those devices end up getting acclimated and pulled into whatever, because obviously they bought the devices with also the account, and just gets recycled and recycled and recycled. And that's kind of the landscape we're in right now, which isn't necessarily beneficial to patients or the end user. It just makes stuff logistically a little bit more conflated and confusing.
There's so much confusion out there. I think the other thing, especially going back to trying to convince people how to do this better, make it make sense for them. I think the other thing that they don't understand, and again, as a provider, they are seeing things from patient care is me, my nurses, my staff, and my patient in front of me. A lot of times they take for granted the equipment that is working around them at all times. I think we talked a little bit about this on our podcast, which is care should be defined as patient plus provider plus medical device. There's hardly any care today that gets provided just by a doctor or nurse looking at somebody, or they're going to do this and check their blood pressure. It's, you at least have some kind of cuff, some kind of monitor, some kind of temperature gauge, some kind of utility item that is helping you create diagnostics. And the fact that they take it for granted is sad a little bit, because and we do it all the time in day-to-day world, right? We have cars. Every time I go into my car, I expect me to turn on the engine and that car will start running. Like, I take that for granted sometimes, but I do know I have to change its oil. I have to put gas in it. I have to make sure, it is still able to run the next day. So when I do turn that ignition, at least 99 times out of 100, it's going to crank and turn on. So I sometimes get upset with, the providers who don't kind of factor in the equipment into in taking it for granted that it's always working, always up and running, but it's the people behind it and all that management and understanding and the education you provide and bring to it that makes that happen. And also showing this is an important part of my patient care environment. And I think that's that holistic part that sometimes gets missed by a lot of people.
I think, it's not just, obviously let's look at it from this, there's been a culture shift since from when I was a kid, back in the 90s to where it is now. Technology has changed everything with the strides that we have made technologically. I mean, if you just think of what you brought up, and then also cell phones.
Oh yeah.
A lot of people can't function nowadays without having, because everything is tied to your phone, your banking, your navigation, your emails, your, simple communication with family members, social media, looking up any kind of knowledge through Google and Wikipedia, whatever. That same thing translates to medical devices. There is almost, an idea or kind of like a back of the mindset that, it's there, it's a tool for us. And when you have something so easily accessible and usable to make your life easier, you lose appreciation of it. So at least until it goes down, then you realize how important it is. And this goes into, the general aspect of people not knowing what a biomed is. You don't realize how important behind the scenes some of my colleagues out across the United States and in the world are having an impact on everyday people's lives. Everything that gets hooked up to test vitals, to help treat injuries or maybe diseases, every one of those devices are managed, repaired, calibrated, and overall serviced by the Biomed. And this goes back to where we started the conversation. Are you ensuring that all of those things are being provided for that medical device and all of your devices within your facility? Because if you're not doing a service to your patients at the end of the day. And that's what all of our services, biomed, nurses, physicians, anesthesiologists, radiologists, at the end of the day, that's our mission. That is our mantra, to elevate patient care, optimize it, and ensure patient safety. If we're not doing that to the best of our ability, then somebody's either not caring or is ignorant of the fact.
Yeah. I personally have never met a biomed that doesn't understand that. They're not doing the job for the glory. They're doing it because they know it's a valued service, and they want, if they were ever in the hospital, their family members are in the hospital, every product that's on them, device, whatever it might be, is to the top quality and the best of their ability, because they want the same treatment when they might be in there.
Yeah, we're kind of civil servants in that fact.
Yeah.
One of the organizations that handles all of our accreditation and everything, Amy, they do a survey every year. Over 70% of the people within our field would recommend our field because of how rewarding and how much at the end of the day they go home feeling like they made a difference.
Yeah.
And that translates to, you find a lot of biomeds that are happy with where we are because, we get a sense of we're doing something and we're proud of it and we take pride in what we do. And, we're going into the job day in, day out, really coming home and feeling like, I love what I do. I'm ready to do it again tomorrow. I would think that I kind of present that, considering I did an entire podcast tailored to my field. But yeah, I would agree. I think majority of my colleagues love what we do and we take it very seriously. And sometimes it's frustrating as well, coming from a biomed's perspective, speaking with somebody that's not managing their devices the way they should be. And, at the end of the day, we're passionate about getting it right. And sometimes it comes off like people may not care. And that can rub me wrong sometimes, some days.
Yeah, because you care so much. And it's like, how can somebody not care? And it's like, you just feel like you're on different sides of this spectrum, that everyone should be in pretty good alignment of what you guys do and what it means.
Well, yeah, the medical industry is a $1 trillion, industry. And then the medical device industry is quickly going up to the overall span of what the medical industry is costing. It's growing every single year. And, rightly so. There's advancements in treatments and technology and just ways we're doing those treatments. And then, the optimization, which is what happens when technology grows. But there's almost a stigma to where we have kind of like a back of the mind mentality that medical device servicing and just patient care in general is tied to the dollar. And I wish we could move away from that a little bit. Obviously, money is necessary, but it shouldn't be the driving force in patient care. That's what we need to get away from. And I think the U.S. medical infrastructure is tied directly to, cost versus benefit. Whereas you go to other countries that have universal medical care and everything, and, it's not tied to the dollar. It's tied to just providing care. You go to another country as an American and I see videos all the time, like I didn't have to pay anything.
You just walk in.
Because it's not tied to that. I'm not trying to get political or anything with this. It's just, it's a mindset, and it's something that cost is driving everything we do in medical care, period.
Yeah. It's the incentivization.
So that's just kind of the way it is.
I think
nowadays.
it's like the incentivization model, right? It's like, it's a tried and true thing, and something talked about in all business books. Like, you measure yourself on KPIs, you drive a entire business that direction, and you achieve those metrics.
Yes.
For the healthcare system here, I mean, again, not trying to be political, but just saying it like in generalities, is if you're incentivized to make money, which is what a for-profit hospital does, and most hospitals are for-profit, you're incentivized to make money, and you are not incentivized to expand on cost. You're not incentivized to buy the Ferraris of everything. You're incentivized to figure out where the margins are and squeeze those down as humanly possible while not evading any kind of, fiduciary care to your shareholders, but also not giving the service that you expect patients expect. So you're trying to balance a fine line, but you're not trying to go above and beyond the fine line. And to me and you and to everyone who wants patient care, we want people to be operating way above that fine line. I'm not trying to get the standard minimum. I'm trying to get the best possible result in care. And unless I'm going to pay tons of dollars to go to that, really expensive place out there, it's all about people with incentivization models that are driving to make certain decisions. And that's all it is at the end of the day.
Yeah. So while I was on your podcast, which, before I get into my next topic, I would love to give you a chance just to plug the podcast, for people that may not be aware of it, because I love, the mantra that you guys have. It's no filter. It's come on, speak your piece, share with us some information, foresight, and just kind of give your take that other people might not know about. So I would just love to hear just how the podcast started, and just what your mission, what your vision is for it.
Yeah, honestly, it was started just to give a voice to those who might not have voices. Or you have your podcast, which I respect because I love what you do and what you promote. But there's not a lot of those people in those avenues out there, right? At the end of the day, what I wanted to do is create a more generalized version of just no filter healthcare for those who might not be providers themselves, but offer services into the healthcare ecosystem. Just come on here and talk about who you are, what you do. Just want to get you out there. But two, talk to me about something that you wish you were able to say out loud, and that might frustrate you. Maybe it's not frustrating, but you just want to just say it and make sure people understand it. And for you and your message, obviously, the no filter healthcare was beautiful. And so that's, you really kind of absorb that hashtag that we have. But at the end of the day, there's other people out there that are like, okay, I tried to start a business in this industry in healthcare, and people are really resistant to change. And it sucks because healthcare needs to change. And it's like, saying that out loud, letting people absorb that, and letting other people and other vendors and other service providers in these industries sometimes feel like you're not alone. They feel the same way. They're running into the same obstacles. We're all screaming at the same wall. So at least you are side by side with someone screaming at the wall. It's not just you alone anymore. That's kind of the way.
Yeah, it's us coming together with a shared, initiative, because anybody that truly cares about elevating patient care is going to have some sort of problem from their particular avenue with the current system.
And everyone comes at it.
And the people say that there's nothing wrong with the healthcare system in general whatsoever. They're either not a part of it, they're not in it day to day, or they just haven't been paying attention to, labor shortages, nurses walking out, my field having labor shortages, training opportunities. And then what I want to get into next is right to repair, which affects everybody, because it's not just, I can speak to the medical device, but it deals with cars, deals with cell phones, computers, everything. And this has kind of been an ongoing challenge for probably over a decade at least, getting the Senate to recognize that. Let's look at it. If you are a consumer, you should have the right, the ability to have the resources made available to you to service, repair, whatever you need to do, what you own, what you purchase. Yeah. I mean, that's basically the standard thing. So let's look at it from our standpoint, from a hospital standpoint. Hospital buys any particular device and they own it. It's on their books. They have to claim it. They have to service it. They have to assure that it's regulated and taken care of. So if a hospital has to abide by all of those principles, then they should also have some freedoms or, abilities to work that in their favor as well. I mean, if it's really truly theirs. And where the Biomed perspective comes in, that, this has been an ongoing mission of mine and many other of my colleagues, is we are very hindered when it comes to supporting medical devices just by not having service literature available, not being able to utilize tech support of the OEM, which we will reach out to if we're over our heads or maybe have a question, not having accessibility to parts, and then not having accessibility to training to work on that equipment. And I read articles from multiple news outlets and pundits and legislators, and they have the same, I think we call it FUD, is, disinformation almost, or maybe coming at it from a perspective that might not be 100% true. If a Biomed that is not completely affiliated with the OEM has access to service, repair, maintain their equipment, it's going to put patients at risk and will cause deaths. And I read that and it offends me on a level. And I've talked to so many of my colleagues that will read that, or will have that discussion thrown in their face. And at the end of the day, the Biomed wants to do stuff by the book. We want to ensure that we're able to facilitate the same level of care for these medical devices that OEMs say we do not. So there's a separation of, two different talking points. And what the Biomed is trying to do, which we recently had Justin from the Better Biomed channel and Dustin Zimmerman from the Avante Arts program go speak to Congress in the beginning of July to voice our concerns. And at the end of the day, our goal is to have one seat at the table while the OEM has another seat at the table. And hey, let's navigate what our issues with, are more so concerns with supporting each other can be. And let's find a solution. Whereas, throwing more and more FUD into the bucket and just pushing it down the line to eventually what I think is going to happen is the FDA is going to ultimately end up with a decision to figure out how we're going to regulate this. I would really long-winded, and I apologize for that, but you brought up a report during our conversation on your podcast. And I just want to go through the main points of that report and just give people the information so that they can make an informed decision for themselves.
That report is huge because I know it's a lot of, like you said, you feel offended as a Biomed for some of the things that are said by the OEMs, but me and you both know that same OEM is going to call you to do the repair anyways when they can't make it out there. So it's a little bit of, they say one thing, but they do the other. And it's really because they're protecting their business. They don't want to, they're shareholders in their business. It's not about the patient. And at the end of the day, they complain to Congress. They themselves complain to the FDA saying, look at all these biomeds. They're not certified. They're not beholden to the same regulations that we're beholden to. And like you even mentioned, there are ISOs out there that have 9001 certification. They're doing what they're supposed to be doing to make sure that everyone.
9001, 13485. We're going after and getting them because we want to go by the book and follow the rules. But they're not saying that.
And that's the thing is like, no one's giving you the pathway to say, what do we need to prove to you to say that we're just as good? So, back in 2018, when the FDA actually submitted this report to publication, was initially supposed to be a review of all the patient safety events that happen with medical devices and maybe the contribution causes. And they wanted to paint a picture that independents were a bigger cause to patient safety, because they're not repairing things right. That's why machines are failing more. There's quality issues. They don't know what they're doing. That was a picture they were trying to paint and the reason they pushed this report. The findings of the report were the exact opposite. The findings of the report actually said there is no discrepancy that is noticeable between an independent biomed and a OEM biomed. And not only that, they took it one step further to even say in the report and their findings that independent biomeds are absolutely necessary for this ecosystem to even exist. They need to be there. We need that extra support because there's not enough biomeds out there. So if we're trying to shut down half the market, we can't do that. So the FDA actually not only talked about how the independents of the world are doing a good job, or just as good of a job as the OEMs, and that they're absolutely necessary to exist and survive, and we need to prop them up. That to me is like the totem pole I would go down to Congress with and say, look, if you're going to let the FDA make this decision, let them make it. It looks like they already have their minds made up, though. We're not harming patient care. We are absolutely benefiting the ecosystem at large. And that's what I think everyone knows, everyone believes, even the OEM technicians believe and know. They're just not allowed to say it because that's not what their company's allowing them to say.
Well, I've spoken from several people within different OEMs because the OEM Biomed is just as much of our community, if not a more vital component of our community, because us that aren't affiliated with OEM, you know, we're left out of constraints sometimes just because we don't have that support. And it's through our fellow brothers and sister biomeds out in the OEM community that are supplying us with those tools and that literature behind the scenes to ensure we can take care of our little LTAC or CAH hospital out in the middle of nowhere that the OEM will not go out to or tap on the shoulder of an ISO to get to. So I am the first to, you know, thank the OEM Biomed because you guys are vital. You guys are what are keeping us afloat out here.
Oh, wait, and can I say one thing? I want to clarify. Just because what you said is absolutely perfect and right. When I say OEM, I'm talking company, corporate body, not the biomed themselves who is doing the work, who knows what you, like I said, they know the value that you and all the other independents in themselves bring. They're the ones actually fighting the good fight within the big organization. They just don't have the power that me and you wish they had to talk about corporate rules and, you know, not letting you have access to parts and all that other stuff. So I want to just clarify what.
And what's so funny too is we're not trying to take away from their business. We're just trying to add options to the end user that is directly responsible for patient care. The worst feeling in the world as a biomed, which unfortunately I've had to make this statement many times to customers over the past couple of years, is I am so sorry. I do not have access to parts. I do not have access to literature. Tech support literally laughed at me on the phone when I asked for anything. That has happened. And you will have no other choice than to spend whatever price they throw at you, whatever OEM this may be, to get support or get your unit fixed. My hands are tied, and that's the end of it. That is the worst feeling you can give to anybody, especially when we start talking about budgeting constraints and everything else. And, you know, some of these hospitals, LTACS especially, that are struggling. Let's be frank, the OEM model, they don't make their money really outside of after the contract. So their money isn't going to be beneficial per the PM. It's going to be the repair costs, the service after the contract, and then whatever money they got for you purchasing the device. So why would they give up their bottom line to supply these resources to us? Because that's going to hurt shareholder interest. I understand there's other parts of this, and that's fine. Like I said, it doesn't bother me because everybody has a business. Everybody needs to be able to support their families and everything else that goes along with that. That's fine. All we're asking is a seat at the table, and whatever means of negotiation and understanding that comes with that, what have you, so be it. But we're kind of in this middle frame. Like we were talking offline a minute ago. New York passed the first right to repair bill for electronics, but medical devices aren't included in that. And it's a notch towards the right step, but it's a notch. It's like, here's medical devices, and here's
my TV is more important than my vital. Essentially, is the The right to repair my TV is more important.
Hey, some of these TVs are expensive nowadays.
No,
For anybody that wants to learn more and read more about this FDA report, put it in the comment section for people to reference that and go explore more to see that we're not just talking out of our ass.
And obviously, you've talked at length about the number of biomeds and the shortage of the industry and the labor market, and even the aging of the industry itself. And one of the things that I want at least your listeners to also understand is, because I don't think the biomed's been put at the forefront of a lot of these conversations in the past, and hopefully it's getting more and more out there as some of us have gone to Congress and tried to lobby for more ear time. But we already, as a country, are moving legislation, reimbursement policy, and even the patient care model to be closer to this outpatient and ambulatory and eventually in-home model of care. And the reason I need to bring this up is we already have a very strained labor force, which is you guys, everyone who's supporting the medical equipment. And right now, it's a little easier. I'm not saying it's easy. It's a little easier for a single biomed to go to a large health system and maybe tackle 100 devices over a period of a couple of days. It's you have a high density. You can do a lot more in a single place and time than you can if those same, call it 100 devices, existed over 20 locations, which is now urgent care surgical center. You're starting to see, advanced complex equipment get into these buildings, which is fine because me and you as consumers, we get better care local to us, probably for a little cheaper. So we win. But we've created a logistical nightmare for the biomed, who already his time is, over indexed. And as we go to in-home, that's just now, instead of 10 devices per building, it's 1 device per building. So we've now even created a crazier network. So until we can either increase the labor market to support this sprawl of equipment, increase access to parts to where we can support the sprawl and, maybe attract new entrants to the actual industry for biomed, or if we can have people do some kind of at least self-management at some level, some tiny bits of, hey, here's a self-help video, here's a manual, here's a access to a quick hot swap part that won't really, be considered remanufacturing, but it's just me replacing an air filter in some, easy component. We're going to set ourselves up for a nightmare. We're going to be just like your LTAC, who couldn't get maybe a normal OEM technician out there. That's the least of the worries when they have to eventually go to people's homes. So I know that this fight that you're creating now, or we're creating now, is going to benefit where we're trying to all go as a society for healthcare. And until we figure out how to increase access to parts, service, increase the labor pool, we're going to be in a moment that we might be sitting at home on our dialysis machine 20 years from now, waiting 2 weeks for a tech to come out while I need that to, save my life. And that's a world I don't want. I do not want to be right about that. I want to get it right now, not later on, whenever it becomes a problem. So that's my little
Proactive instead of reactive.
I'll get off my stuff.
Unfortunately, we're very reactive right now.
So I appreciate all you guys do.
No, I love that. Yeah. Medical care is always going to continue to expanding. And like I said, with going into OEMs are not going to be able to take care of every urgent care, ER, LTAC, in-home service. Like it's the logistics behind it does not support the numbers or the arguments. So there's going to have to be some understanding at some point.
You're not going to be able to conquer the world.
I like to end the show on a fun note. One segment that I like to call the modality. There we go.
Oh, the modality.
All right. So the modality, simply enough, is if you have any kind of recollection of maybe a funny or scarring story that comes to a particular medical device during your tenure in your career.
It's more of an embarrassment whenever we were getting trained to look at working on imaging equipment. I worked at TriMedics back in the day, and yes, I was a clinical engineering manager, but I also tried to learn some of the service and repair stuff and, getting my hands dirty to do some of that service support. And I remember the first time I saw a Phantom for calibration and not knowing what the heck it was. It looked like some weird gel device and whatever. And I was just like, yeah.
Right? Yeah. There's a big box with gel in it.
Understanding what it was, how it worked, and just looking like, this goes on this machine. And I basically stood out of the class. It was a very embarrassing moment of just not knowing how calibration events even worked on imaging equipment, because it's not the same as an infusion pump or some of the smaller devices. I'm like, oh, you just do this, it's some buttons, and it's not as hard. And so having all these objects in front of me, I was completely a fish out of water. And it was a very interesting one because everyone else there at least had some imaging training and had some kind of level of understanding. I was the only one that was like, what the heck is this? Are you sure we're in the right spot?
It's kind of some of the equipment that we use in our field is kind of it takes you a step back a little bit. I don't know how to use this, or this doesn't look right.
Weird. And I was like, how is this possibly going to help with this machine? And get it right and get all the calibration done. And I was just really confused. And it was a moment that I was completely embarrassed myself. Yeah.
But you got past it. Biomed's figured things out inherently one way or another. So I got one more segment for you before I let you go today.
To be or not to be?
So to be or not to be, simply think of any medical device you can think of, take the functionality of it, and that is your superpower. So what would Jinesh's superpower be?
Yeah, it kind of helped you. I'll say that you tried to help me out earlier thinking through this, and I'm still.
So I always tell people mine would be a defibrillator because I can use electrical discharge to shoot electricity at people.
I was trying to get too nerdy with it and I was like, okay, it could be an MRI because you're pointing hydrogen molecules in a single direction and you can kind of help navigate where they go. But I was like, what is that going to do as a superpower? I have no idea how to actually make that something that.
You can get just simplistic with it, or you could get super in depth with it. It really just matters how your mind goes.
Maybe an ultrasound. It'd be cool to use sonar technology to kind of navigate through objects. And, eventually, if I can understand and see what's beneath me, I could strike oil or some gold.
Well, I saw it too. You could see, maybe someone's heart speeding up. So you can know if they're reacting on an emotional level a certain way. Maybe they're lying to you, or there's exactly. No, like I say, you don't have to be overly complicated with it, but I had to have something like this because I think about this stuff during my off time. I'm a nerd and I love what it is. So Jinesh, I appreciate you being on the podcast today. It's been an absolute pleasure, sir. Look forward to working with you more in the future, and I appreciate what you do to give those that don't have a voice an opportunity to speak their voice. And that's ultimately, the mantra for your podcast. And then also what your company provides to customers as well. It's a worthwhile endeavor. So I just wanted to give you your flowers. Appreciate what you do, sir. It's been a pleasure. For anybody that would like to enlist Uptime Health Services, or possibly learn more about the podcast, where would you
find us at
to go?
UptimeHealth.com. Everyone probably listening to the show knows how to spell Uptime and the word health, so just add those. And then podcast,
I'd hope so.
It's just called #NoFilter Healthcare, all in one word. It's on any Apple, Spotify, anywhere you can find a podcast.
All right. Again, thank you for being on today.
I got all
may the
ready
beard
for
be with
today.
you.
Yeah, so I knew I was going to.